Dear students, let us discuss about the VOLKMAN'S ischemic contracture. Let us see what is meant by contracture and what is meant by ischemia. So contracture is permanent tightening of muscles, tendons, skin and adjacent tissues that will cause shortening and stiffness of nearby joints. This prevents normal movement of a joint. So that is contracture. Hope now you have understood what is contracture. It's nothing but permanent tightening of the muscles, tendons, skin and adjacent tissues. This results in shortening and stiffness of the joints that are nearby, and it prevents normal movements of these joints. And then what is ischemia? So inadequate blood supply to an organ or a part of the body. In the present case, it is the part of a limb which contains the muscles. So that's how we have to take it. And VOLKMANN is the person who has identified this condition. Now let us see the picture. In this picture you are seeing the lower end of humerus, the upper ends of radius and ulna, and the relation of the brachial artery and median nerve and the ulnar nerve in relation with the humerus, the elbow. Now let us define the VOLKMAN'S ischemic contracture. Compression of brachial artery or impingement of median and ulnar nerves at the lower part of arm or elbow, leading to the contracture or necrosis of flexor muscles of forearm. That is the definition of VOLKMAN'S ischemic contracture. So this results from compression of the brachial artery and impingement of median and ulnar nerves at the lower part of arm or elbow, especially the brachial artery and median nerve, which are, as all of you know, are underneath the bicipital aponeurosis, and they are also closely related to the lower end of the humerus. So it results in contracture or necrosis of the flexor muscles of forearm, especially those supplied by the median nerve. In this picture, you can see the lower part of the arm, the cubital fossa. You can identify the biceps brachii muscle, the tendon and the bicipital aponeurosis. Here you are seeing the boundaries for the cubital fossa underneath the bicipital aponeurosis and along the medial margin of the biceps tendon. You are seeing the median nerve and the brachial artery, and behind you are seeing the ulnar nerve. So these are the structures that are closely related to the lower end of the humerus. That is the brachial artery, the median nerve and ulnar nerve. After defining the contracture, ischemia and the relations of lower part of the humerus, the elbow joint area and the cubital fossa, the relationship of the brachial artery, the median nerve to the bicipital aponeurosis and the relation of the ulnar nerve to the lower end of humerus. Let us see what are the causes for VOLKMAN'S ischemic contracture. The most common cause is trauma. The others are the burns, the bleeding disorders, internal bleeding in the vessels. Then there is the prolonged external pressure from the tight dressing or cast in relation with the lower end of humerus. The most common cause is trauma. So the trauma results from fracture in the elbow region or upper arm, especially the supracondylar fracture of the humerus, that is the fracture of humerus near its distal end above the epicondyles. You can see in this lower picture. So the fracture of the distal end of humerus, we are dividing it into two fragments. The lower fragment moving upwards and backwards, the upper fragment moving forwards. And this supracondylar fracture of humerus is the most common fracture in the pediatric age group, and it results from a fall on the outstretched hand. So the most common cause is supracondylar fracture of humerus and more common in children, and it results from a fall on outstretched hand. What is the explanation for the VOLKMAN'S ischemic contracture? When there is fracture of lower end of humerus above the epicondyles, the distal fragment of humerus is moving upwards and backwards, whereas the proximal segment, which is sharp, it is moving forwards. And when it is moving forwards, it is pushing the median nerve and brachial artery, and this results in hemorrhage and edema that will compress the brachial artery and causes impingement of the median nerve. The acute ischemia leads to the contracture and necrosis of flexor muscles of forearm. To begin with, the flexor digitorum profundus and flexor pollicis longus will be affected, and in severe cases all the flexors and extensors also can be affected. So in this picture you are seeing the necrosed flexors, majority of them, and then some of the extensors also you are seeing. And the muscle tissue will be replaced by collagen tissue, which causes the contractures. Because of nerve injury, there will be dysfunction of the muscle, sensory loss, and chronic pain can be felt. So in this picture you can see the relation of the brachial artery and median nerve in relation with the elbow. If you observe the position of the limb in a severe case of VOLKMAN'S ischemic contracture, you can observe there is flexion at the elbow you are seeing, and then there is pronation of the forearm, there is flexion at the wrist, and there is extension at the metacarpophalangeal joint and flexion at the interphalangeal joints. And if you see the thumb, so there is adduction and flexion of the thumb. There is involvement of the median and ulnar nerves in a severe case of VOLKMAN'S ischemic contracture. Clinically, the symptoms of VOLKMAN ischemic contracture can be remembered by 5 P's. The letter P. So there is pallor, which means paleness of skin, pulselessness of the vessel, so we cannot feel the brachial pulse. Then there will be pain in that area. Then the paresthesias, the sensory changes. The motor observations will be paralysis of flexor muscles of forearm. Now, after learning about the VOLKMAN'S ischemic contracture, you will be in a position to answer the multiple choice question. The most common fracture in children under 10 years of age involving elbow is tennis elbow, golfer's elbow, student's elbow. The right answer will be the last one, that is the supracondylar fracture of the humerus. Hope you have understood about the VOLKMAN'S ischemic contracture and the common cause for which is supracondylar fracture of humerus, and then more common in children, and there will be compression of brachial artery and impingement of median nerve, and it affects mostly the flexors of forearm, and in a severe case flexors and extensors of forearm will be affected, and the characteristic description of the limb you have learnt.